Jason Phillips again. He's had a little more rest, and he's had some time to look up some stuff to talk more about the dangers of obesity and why even an extra 10 pounds can be a problem. And he's going to be talking to you tonight about it. And if you have questions, feel free to ask online. And if you ask later, we will also answer any questions that you have. Hi, Destiny.
Hello, guys. How's it going? I wanted to go over. I had a chance to. Number one, I'm more awake tonight and not just coming off a 48-hour shift where I was completely dead in the water. My brain is active now. But I have a little diagram here I'm going to have Emily put up on the website later. But basically, as you get more adipose tissue or get obesity, even 10 pounds, it releases certain chemicals called interleukin factors, tumor necrosis factors, that increase the amount of inflammation in your body. And that can be demonstrated by a general lab. As physicians, we call a SED rate or a CRP, which is a C-reactive protein. And that number generally will be higher in obese patients or people that are heavier. And because of that inflammation, it will cause your body to have insulin resistance, or in other words, the insulin will not act at the side of the cell, and your muscles are not able to be as active and decreases their metabolic rate. And basically what happens is with adipose tissue, you get more obese, you get insulin resistance in the body. So when you get insulin resistance, let's say like you're eating a salad or any other type of food, and it's converted, the gut does its little thing and converts it into the molecules that your body and the components that your cells can use. The insulin is like the key that helps those chemicals get into your cells in the body so they can utilize it for energy. But what happens is the key gets rusty and can't fit as you develop insulin resistance as you get obese. And the easiest thing for the body to do to stick calories, if there's more, is to stick it into fat, which is adipose tissue. So it builds on each other with the inflammation. It's just like a rolling train.
You're getting lots of thumbs up from Rita. She agrees.
So that's basically going to be the bottom line on it. I could go in all into the different chemical stuff, and it was really kind of complicated for me to go through. I looked at several studies I found today online that recently published from 2019 to 2021 regarding this subject. So the basic thing is to help reduce adipose tissue, and losing 5 to 10 pounds is healthy because it decreases your insulin resistance and your overall inflammation in your body. And people that have increased inflammation in your body are going to be increased risk for heart disease, stroke, high blood pressure, high cholesterol, inflammatory disease processes such as like rheumatoid arthritis, lupus, and other problems.
So, for example, what's the difference when you put a Snickers in your body as opposed to a healthy salad? What happens in the body? What's the difference?
Well, you're putting more calories in your system, and when you're eating salad, some of those calories are not. It's going to go through the gut, and not all of it will be absorbed, but it makes you feel full. And you get a sense of what we call satiety, or your stomach feels full when you eat salad. When you eat complex sugars, such as like is in a Snickers bar, your body is able to convert all that energy and absorb it, and it goes into your bloodstream. And basically you're overloading your body with too much energy and calories, so what it doesn't use, it sticks it into fat or adipose tissue.
Someone's asking, can we please talk about obesity in children? It's a real problem. Why do you think it's more today than ever?
I don't think kids play outside as much as they used to. I think parents stay on top of kids too much these days. and don't allow them outside to be active and run around. There's a lot of trash food that's available now that wasn't even available when I was a kid. I remember when I was a kid, my mother kept all sorts of fruit and stuff in the fridge. One of the biggest risk factors actually for kids gaining weight is drinking juice. That was found out to be one of the number one factors in kids' obesity is drinking orange juice, apple juice, and all the calories associated with it, and not diluting it with half water and half juice, actually, believe it or not.
You know, one of the things that I'm figuring out is back in when our parents, when we were little, we would get a treat like once a week, and now the pantries are stocked with all these things, and the kids come home expecting them and craving them and almost addicted to them.
Right. Yeah.
You notice that?
Yeah.
Even in our household, when we stock our pantry, it's gone in one day. It's like people have gotten away from the once a week.
And I pitched a little bit of a hissy fit today when my breakfast bars were all gone when I went in there to the pantry to get them.
But it's almost like an addiction.
Well, it's not an addiction, but for some kids it is, because here in our house, our stuff can't stay safe for 48 hours, so it's all gone. And that's even us trying to buy healthy. Majority of it is just kids not being as active and having access to more calories.
Maybe not getting enough sleep and too much technology.
Yeah, but majority of parents I talk to have got a pretty good, doing the right thing, got a pretty good clamp on that when they can get the kids off technology around bedtime.
Would you say it's probably not the best thing to be playing video games right before you go to bed?
No, that needs to be shut down an hour to 45 minutes to an hour before things need to start being winded down, 30 minutes before.
How can that affect children, would you say, if they're watching a video game right before they go to sleep?
They get overstimulated and their brain won't turn off.
Yeah. Somebody asked, why is it so important for us to feed kids well? Because I can't convince my husband to stop the McDonald's runs, etc.
Well, how you teach your kids to eat in childhood is how they're going to eat in their adulthood. So if you teach them to eat like trash, they're going to eat like trash when they get older. They can burn the trash off when they're younger and as teenagers, but when they get past about age 22 to 25, they're not going to be able to burn it off.
One of the things that you had said to me a while back was it's important, especially for young girls, to have a healthy weight because they can actually start developing sooner. Is that true?
As a general rule, right now we have found that young girls are probably starting puberty earlier right now, and we're finding some evidence that may be due to the hormones that's in food. And if you're obese, girls are more likely to enter puberty earlier. Also, that I have observed that even when I was in practice.
Really?
Yeah.
That's actually a pretty fascinating thing. So you're saying that you can actually change when a girl is supposed to go through puberty?
Yeah, because adipose tissue will develop. What does secrete a little bit of testosterone and estrogen. That's why fat guys have boobs. The adipose tissue makes them develop estrogen, which makes them develop breast.
We talked a lot about heart attack and stroke last night, and one of the things you said is the amount of fat around the organs that's causing.
Well, that's one factor. There's a lot of factors. There's 5 general not recognized risk factors that go to heart disease. It's smoking, diabetes, hypertension, high cholesterol.
Which all goes with obesity.
Yeah, which all goes with obesity. Genetics is going to play some component of heart disease. There's a big heart component of that with family history. But when you get a lot of fat deposited around the organs, around the heart, it puts a lot more stress on them than we think it does. And the obesity, especially the what we call the apple core obesity in the middle right here in the gut, is the one that we're finding is probably really hard on your system.
You know, you've told me sometimes you can look at somebody walking down the street and immediately say he's going to have heart issues. Is that because the heaviness or the way their face is bloated, the inflammation?
I just kind of one of those things you learn to see.
Yeah. Yeah.
Like I can tell when a patient walks in the ER and I got a kidney stone. They come in walking in a certain way.
Visceral fat, what is that? VIS.
Visceral fat is the one that's around your abdomen. And in the fat that's deposited inside your gut, around your intestines, liver, organs, things like that.
So that fat is the most dangerous.
It can be. It can be a risk factor. It can put the most stress on there. But any type of fat is dangerous.
So I've actually had relatives that had, tremendous amount of weight around the top body and not much at all on the bottom. Is that?
That's more your genetics probably coming into play there a little bit, where they're going to deposit fat. Maybe I think some of it also to do with the activity levels they probably had. Maybe they were younger, if they were runner or ran a lot when they were younger, that maybe but I can't.
So let me ask you a question. What do you say about people that work out every single day? They're in the gym every single day and they're still obese. Well, first of all,
my statement is you can be heavy and be healthy, and you have to find out where your weight is what's healthy for you, what you feel like you feel comfortable with your body image is, and what's realistic for you. My ideal weight is between 195 to 200. That's why I feel the best. According to the federal government, I should weigh 178 to 182 pounds. If I did that, I would look like I was sick. And I've actually been that low in my weight. I didn't feel good, and I got cold. So I feel better. My ideal weight being 195 to 200. But just some people, as they work out, it depends the type of workouts that you do. But
and the food that they're eating.
And the food they're eating. But just some people, they can work out as much as they want, but they're going to reach a plateau on their body habitus from their genetics and depending on what they're eating, and also if they're developing insulin resistance that's inherited because they have a family history of diabetes, or the type of exercise they're doing, or maybe the supplements they're taking. But a lot of that, if you weight and if you're working out every day with your weight, as we get older, some of that's going to be due to your health problems, genetics that you're predisposed to with your health problems. Thyroid and diabetes play a big component of that if they're not treated appropriately.
Are there any health problems that can be reversed from weight loss?
Arthritis.
Really?
Joint pain.
Can you talk more about that?
Well, as you lose weight, you're not putting as much weight and pounding on your legs, knees, hips, and lower back. It doesn't wear out as fast.
Can weight gain cause arthritis?
It's going to cause joint pain and worsen arthritis. I wouldn't say. Let me repeat what I said. Let me rephrase what I said. It's not going to reverse. If you have bad arthritis in your joints, it's not going to reverse it, but it'll take the pressure off of it where you're not going to have as much pain.
About cancer, you said the only cancer you know that obesity could hurt would be breast cancer.
Yeah, and with the more research I did today, and all malignancies are different, but if you're obese, the inflammation from the adipose tissue could perhaps make any cancer worse with the chronic inflammation from the adipose tissue, according to the articles I read. But that's very preliminary data and not hardcore fact yet.
So is this okay? So we're going to ask you a couple of things. Is this a myth or is this medically proven? Does cancer love sugar? I've heard that cancer loves sugar. That the more sugar you eat, the worse than your current cancer can get. Or is that a myth?
I don't know the answer to that one.
Okay, maybe you could look into that, because I've actually heard people that get cancer.
That's how PET scans work. Is they do a tagged glucose cell into the cancer, and the cancers have a higher metabolism. It concentrates there, so that's how PET scans done, looking for metastasis or Alzheimer's and other things like that.
Can obesity affect Alzheimer's?
Don't know the answer to that one. I don't think there's a direct tie between obesity and dementia and Alzheimer's.
You don't? Even if it's putting pressure on the organs around the brain, and no?
No, I don't know the answer to. I would imagine that it probably doesn't help it, but I can't say there's a direct tie with it.
Okay. Anything else you were reading up on today that you want to talk about? With a lot of people watching.
No, that was about it. I just wanted to kind of clarify what I had said about some things. I guess some people had some questions.
Yeah. Does anybody have any questions for Dr. J? Let me see some of the comments that we've got. Simple sugars, HCRP, TNF. Let's see.
I think somebody had a question about testosterone and thyroid testing or levels. I had responded to on Facebook.
What did they ask?
I don't remember.
Okay. What are your thoughts on weight training versus cardio?
It depends what your goal is.
Well, I mean, I've just always heard that I always used to think you had to be doing cardio every day to lose weight, but now I think recent studies are showing that actual weight training is actually can prolong your life and help you not break bones later in life and things like that.
That's true. And if you do both of them combined, is you're going to be healthier doing that rather than if you go for bulk or weight all the time, you are going to put too much stress on your organs. And your weight can get up, and if you just do cardiovascular, sometimes you can get too thin. So doing both is best.
So I had a question for you because I have ADD. I know that I have an addiction to sugar, and I used to remember when I was a kid sneaking downstairs. My mom would be in the other room. I would go and I would eat sugar out of the sugar bowl. And it was like, it must have been an addiction of mine since I was a child. Do you think there's a correlation between actually having a sugar allergy and ADD? Because I've read books that it can actually exaggerate the ADD, and kids with ADD have that serotonin sugar addiction.
Yes, no, kind of. First of all, one of the things I saw when I was in private practice treating ADD when I was in practice was sometimes the red dyes and orange dyes that's in foods can drive a kid nuts.
Now, can you expand on that? Because a lot of doctors won't talk about that. And I always love that about you, that you're open-minded to things like that. Can you tell us?
Just something I've observed.
Like, and how?
The kids, just their behavior is completely off the wall. It just makes them hyper, and some kids just don't do well with it.
Like, are you talking about red Skittles and?
I'm talking anything's got red kids Benadryl. I have some kids that, in order to avoid the red dye, they do fine with clear Benadryl, but you give them clear, they go to sleep. You give them red, man, it is Katie bar the door. They are going nuts, and I can't tell you which kids it is. There's no scientific proof to it. I've seen too much of it, anecdotally.
Really?
Yep.
So you actually noticed that?
Mm-hmm.
So is it anything that's red, basically, like Skittles?
I don't know which red dyes it is. They use a bunch of them, red dye and orange dye. I don't know which ones it is.
Rita's saying red number 40, whatever that means.
And orange number 5 is another one I saw.
Oh, and number 5. That's interesting. Okay, does anybody else have any questions for Jake?
You said the sugar on the ADD.
Yeah.
With ADD, about 50% of people that have ADD will have a serotonin issue or shortage, in other words, people have ADD, 50% of them will have a depression or anxiety issue with it. They're serotonin driven, so kids that have ADD maybe piling sugar on to treat maybe their anxiety or depression, also in conjunction with their ADD.
And what about fish oil? Do you think that's good to help with maybe ADD?
Fish oil?
Mm-hmm.
I don't know I don't know of a tie-in between those two.
Okay.
I haven't read a lot of the new literature on ADD probably in the last 4 or 5 years, so I wouldn't know that.
Okay.
I'm not afraid to tell you I don't know something, and I don't want to give you false information.
No, we love that about you. Anything else that you can think to talk about with us tonight? Does anybody else have any questions? I know it's a little bit later. We're going to be doing these a lot, but it's, kind of getting free advice from the doctor. It's kind of cool. One of the things I had mentioned to you last night that I noticed with COVID, they constantly said the top risk factors for COVID was elderly and obesity. Why is that?
Chronic inflammation.
And what does that have to do with COVID?
Well, the COVID, your body, if you have chronic inflammation in your system, it brings down the effectiveness of your immune system. And when you're heavier, you have problems with your breathing. So if you start getting hypoxic or having problems with your breathing and you're already obese, your body's already working overtime against the fat of the adipose tissue because you're heavy, throw COVID on top of it, you got a problem.
So you just mentioned something. How does obesity correlate with breathing problems?
It puts extra weight on your lungs. They can't expand, and it increases the workload of having to oxygenate the tissue against the weight of the adipose tissue.
Is that why people that are extremely obese have a hard time going up the stairs?
Yeah.
So that's another question I have for you. What is it about going up the stairs? Because I know people that can work out and they're pretty decent shape. They can take a walk, but man, they go up the stairs, and that is incredibly difficult. What is it about that movement?
I think some of it has to do with core strengthening. I played soccer, so I have good core strength. It doesn't bother me. I think it just depends how your body's built, how you walk, and just some people are better at some things than others.
Yeah. Wanted to talk to you a little bit about, I know that you're a big believer in chakra and energy work. Do you think that can help with weight loss with people that are struggling and having blockages?
Define blockage for me.
Well, let's say, like, for example, somebody that mentally is having problems with food.
I think it can help. I think it can help get you more focused and honed and trained, not to give in to the sugar craving.
To get some good energy work
and keep you focused. Yeah.
Yeah.
I'm a believer that if you can do anything in order for me to prevent from having to write a pill or medication, I'm a big believer in. Whether or not it's on the books with medicine, I don't know. Some people I would have as patients would do some pretty weird stuff. I wouldn't approve of it, but if it improved their overall health and kept me from having to write a pill, I was like, by all means. But things like acupuncture are known to work, massage, those have been known to be effective in helping people get pain relief and become more focused.
You hear people talk about the divorce diet. What does that mean? Is it the stress from the divorce that causes them to not eat? And then they fall in love with somebody else and they gain a bunch of weight? I mean, there's got to be a correlation there.
They want to look good. They want to become attractive again.
When they get divorced.
Yeah. They're back out on the market.
So there's no scientific.
I mean, that's pretty simple.
Really?
Yes.
Well, I never thought of it that way.
You got your goods is back out on the market for sale, so you got to make sure your for sale goods are better than everybody else's.
Oh, I see. That's funny. Are there any if somebody were to lose 40 or 50 pounds, could they potentially be able to get off some of all the medications they're on?
Yeah, as you get healthier, you can, if your blood pressure becomes under control, you can get off some of the medications, especially with diabetes. If you're mild diabetic and you lose some weight, I've had patients that pulled medications off of and they've kept their hemoglobin A1C good. They could do it, yes.
Can obesity cause diabetes?
Yeah.
How?
Insulin resistance. Your body's not able to metabolize the sugar, and so it sticks it into fat, and it increases your blood sugar. Now, a lot of diabetes is also genetic.
And some of that we just can't. There's nothing we can do about it.
Some of it you're just screwed with what you're born with.
Yeah.
Kind of like your family.
Right. Rita, do you have any more questions? Amber. Hi, Samantha. Hey, Dawn. The doctor is in the house. He's going back to work tomorrow. Tracy Tanner's watching. My mom's watching. Julie, Melissa, Rita, Jacqueline Ward, Destiny. We appreciate you so much. She said, yes, you have to keep producing more and more insulin. They're probably a minute behind when we're speaking.
Yeah.
Is there a topic maybe we can talk about next week?
I'm open to ideas. I just need to be able to do research. I need to say one thing. All information I'm giving is not professional medical advice. Always see your health provider where not. I always have to say that statement.
Okay. Thanks, everybody. Have a great night. Thanks, Doc.
Yep.
Just lean